As at December 2012, Zimbabwe had 518,000 people on anti-retroviral treatment, representing 95.1% of the population in need of therapy. This performance has been achieved on the back of increased funding from international donors and mobilization of resources from a national AIDS levy to which all formerly employed Zimbabweans contribute. The country has scored its greatest success in prevention of mother-to-child transmission. Over 90% of HIV-positive pregnant women are accessing treatment.
Our setting is made in such a way that we are able to reach every remote area in this country. We have structures and we have health centers in every ward or every village has access to these services. So we are mobilizing mothers and making sure that they seek maternity services in health centers. And then we give them the access to PMTCT services.
There are, however, some hurdles that need to be overcome.
The only challenge that we are facing in that regard is male participation. We have fewer males who are still going with their pregnant women, or let me say wife, because you have to accompany your partner to seek this service so that you are also screened for HIV if you are found positive so that you can access treatment.
Authorities have also acknowledged the need to improve access to pediatric patients. Currently, only 42% of HIV-positive infants are receiving drugs. Authorities say this is due to the specialized nature of testing and equipment needed to diagnose HIV in children.
The process now was quite long. It takes about 6 months or so. So we are really worried about this, and we have seen this as a limitation. And currently we have since made strategies of trying to decentralize this service because it has been centralized.
Under the new structure, health personnel are being trained and equipped to test blood samples at district level, which would reduce the need to refer to a centralized national laboratory. At one point, HIV/AIDS had been declared a national disaster, threatening to decimate Zimbabwe's population. However, today the nation is singing a totally different tune as authorities here celebrate the massive strides made in rolling back the impact of this epidemic. Farai, mwakutuya, CCTV, Harare, Zimbabwe.